I'm kind of fired up.
The free market is the best way to have health care.
I have never felt a fear that I am feeling.
It's a tea party and reading tea leaves as everyone here, including the president, wonders whether he can sway members of his own party and the public enough to get a vote for or against his health care reform package by the time Congress leaves Washington for Easter break next week.
I think something like this has the potential to really transform our nation and make it a really a healthier country.
This legislation is not the right direction, and regardless of whether you're Republican or Democrat, you got a lot of problems with it.
We have to spread our money out in different ways. We have to change. It's a crisis.
It was suburban Philadelphia and this quaint college campus today where the tug of war on this seems stronger than ever.
This basically puts control of our health care in the hands of the government. Huge mistake.
I think it will be beneficial for all Americans.
The president says the time for a vote is now, but still many here vow the time for debate is far from over. And if he's not listening, they figure their members of Congress still are, and will be worried that to ignore their voice will mean to lose their vote.
It's dangerous. It's socialism. It's government control.
As you would expect, not everyone is on board with the president's plan. Plenty of protesters made sure their voices were also heard today in Montgomery County. WFMZ's Bo Colt now has more on that.
Derailing President Obama's health care reform was.
Is there a solution?
Yeah, don't do it.
In a rally-style gathering, protesters, which included several congressional hopefuls,
10 years of revenue to fund 6 years worth of expenses,
and members of the Independence Hall Tea Party Association pushed their points against the president's health care plan in front of Arcadia University's entrance.
He wants them to act on this legislation in the next 10 days.
I think it's wrong for the country.
Why?
Because it's going to cost us too much money.
Rosemary Rao of Northeast Philadelphia says she would rather see the president wait until the economy turns around before trying to turn around health care. Physician Anna Wojciechowski, who works in an urban clinic, says she's seen firsthand patients being left out in the cold and fears the number will only grow.
I worked in an urban clinic where people had government-funded health insurance with the Medicare and Medicaid, and they couldn't get the same tests that I could. They have to go through a lot of barriers, and I just feel the government's not a good person to be put in charge of health care for each person.
For protesters like Seal Denozy, overhauling health care is still a goal, but how it's done is still up in the air.
What works, keep it. What doesn't work, reform it. We are not against reform.
At Arcadia University in Montgomery County, Bo Colt now, 69 News.
While the president was pushing health care, many protesters were pressing their point. They say health care reform under Mr. Obama is the wrong plan. WFMZ's Bo Colt now has that.
No ObamaCare! No ObamaCare!
From perceived death panels to fears of socialism, abortion funding, and bankrupting the nation.
It's going to cost everybody money.
The rhetoric roared as hundreds of protesters pulled no punches in blasting the president's health care plan.
We are not against reform, but we certainly do not like the change that is being proposed right now and shoved down our throats.
Mr. Obama says his 2,500-page proposal would expand coverage to 30 million people, not discriminate against those with pre-existing conditions, and drive down rising premiums.
If not now, when? If not us, who?
But even physician Anna Wojciechowski admits she doesn't know what to believe. Do you understand what's in it? Or
No, obviously not. I mean, it's a huge bill that was, written up by people that even the senators and congressmen don't have time to read.
Jeers greeted the president's motorcade upon arrival at Arcadia University. Patrick Stanton of Jenkintown said he came for answers. After listening to Mr. Obama's speech, he didn't get them.
That's an obvious question. As a businessman, I got to know how you're going to pay for something. And he did not tell us how it's going to be paid for.
At Arcadia University in Montgomery County, Bo Colt now, 69 News.
Burlock, who represents parts of Berks, Chester, and Montgomery counties, says the bill interferes with the doctor-patient relationship. He also says it increases eligibility for medical assistance, meaning more taxes. And he says there's a tax on medical device sales, which could hurt manufacturers.
It's my belief that the president seems to be adamantly moving forward with the same health care reform that's been passed in the House and Senate, but it's not necessarily getting the support of the American people.
Democrats control the House and may use a special procedure to keep Senate Republicans from using a filibuster.